Hi, welcome back to Friday Facts. It's been a while.
It has been.
I'm Dr. Alice Barsoumian. I'm one of the adult infectious diseases physicians here at Brooke Army Medical Center.
And I'm Dr. Megan Donahue. I'm one of our pediatric infectious disease physicians here at BAMC.
We decided to come back for Friday Facts to talk to you about a disease that affects both adults and children, but we're particularly worried about the littles here. And it's called RSV.
And RSV stands for Respiratory Syncytial Virus.
Yeah. So RSV is often thought of as a cold virus, which is true, but in certain populations it can extend to the lungs or cause more severe disease.
Yeah, and this is especially true in infants and young children who have small and narrow airways. One of the biggest ways this virus affects the respiratory tract is causing swelling and inflammation of the airway, which when babies have narrow airways can cause complete obstruction and failure to be able to breathe.
I'm really excited we can talk to you guys about this today right before RSV season begins. So a lot of cold viruses start to recirculate or surge around the school year and the winter time, and we have some additional items in our armamentarium to protect our populations against RSV.
Yeah, and so this will not be the second season now where we have protection for pregnant women and for our newborn infants to help protect babies for RSV.
Yeah, I'm really excited about that, and I'd like you to tell me more about it as I treat pretty much adult patients.
So we have a vaccine that women can get during their third trimester of pregnancy, so between 32 and 36 weeks of pregnancy. It's an RSV vaccine. It's given in our OB clinic. Moms can get that, and that helps provide protection for their infant against respiratory syncytial virus for at least the first 6 months, if not 9 or more months. So certainly for that first RSV season for babies. And then for infants whose moms either didn't get the vaccine or weren't able to get the vaccine or were born less than 2 weeks after mom got vaccine, we have a medication called nirsevimab, which helps protect babies through that first full RSV season. It's a season, both the vaccine and the nirsevimab medication for the babies are seasonal. And so we can also give the nirsevimab to babies who maybe were born before they could have got it in the nursery, and they can get it in clinic.
I think that's wonderful, and I know we certainly immunize pregnant women in their third trimester against other communicable diseases to transfer protection to their babies. So it's wonderful we're able to do this. And this medication is offered in the newborn nursery. That's very, very convenient, and the catch-up program's wonderful as well.
Yeah, and so it can be got during that birth hospitalization before the babies leave the hospital. One less thing to worry about upon going home, but then also can be done either as a walk-in visit in our clinic, probably starting in October, or by appointment if they're having other well visits too. So it's really great. And it can be given to babies up to 8 months old. And then for very high-risk babies, even up to 19 months old, if they have other lung or medical problems that would make them more susceptible to severe RSV disease.
I'm so grateful for this. I'm an auntie to a preemie, and I know we were very worried about RSV when we had older prevention strategies. So I'm glad we have this now. We have a vaccine for non-pregnant patients as well. We do have a vaccine available for older persons aged 60 and up, and you can get that at the BAMC Infectious Diseases Clinic, Immunization Clinic, or you can get that on the economy by going to a pharmacy that contracts with TRICARE, and you can we can set up a link so you can see where your vaccine options are in the comment section.
Cool, that's great. That's really nice for both extremes of patients.
Oh yes, well somebody's going to be watching over those babies, and a lot of time it's the grandparents, isn't it? But when I'm thinking about like going back to school, it'd be wonderful just to have one less thing to bring home to the other kiddos.
Yeah, absolutely, definitely.
Yeah. All right, well that's all we have for you guys today, but expect to hear more from us as we give you updates when we are going into flu season and flu immunization season coming forward.
Awesome. Thank you.
Take care, guys.
Take care.